Good morning. Welcome back to another episode of Eye Openers here at North Shore Eye Health and Wellness. I'm Dr. Kyle Ross, and this morning we'll be chatting about something that's very common, something that I get asked about quite frequently, pink eye, right? I was sitting down with my wife over the weekend, and we were kind of brainstorming ideas to talk about, and she had mentioned, why don't you talk about pink eye? My wife is going to be a nurse practitioner, and so she gets questions about this a lot with her patients in primary care, and I certainly deal with it a lot as well. One of my favorite things to educate people on, because there are different types of pink eye, and we need to appropriately know what type of pink eye we have in order to treat it successfully. Pink eye is a common term used for conjunctivitis. Conjunctivitis is an inflammation of the tissue on the inside of our eyelid, what we call the palpebral conjunctiva, or tissue on the outside of the eyeball itself, what we call the bulbar conjunctiva. Classically, pink eye is what we call viral conjunctivitis, a viral infection or a cold in the eye. Pink eye can also be labeled as allergic conjunctivitis or bacterial conjunctivitis. Now, knowing which type we have is key because it really directs our treatment. And if we misdiagnose, the treatment can potentially be harmful to the eye. I would say the vast majority of cases of pink eye are viral in nature. With the exception of the very old and the very young, they are more susceptible to bacterial conjunctivitis. When we are treating the conjunctivitis, this piece of equipment here, the slit lamp, really allows us to target the treatment and diagnose accurately. Without the slit lamp, we're just guessing, and it can be very challenging because the symptoms and the signs can be similar between all three of them. I think when I am educating patients on this, the number one thing that I recommend is if there's something wrong with your eye, come see your eye doctor. And it sounds pretty straightforward, but sometimes it can be a little confusing. Do I go to my primary care physician? Do I go to urgent care? And I think the best answer is call up your eye doctor. Often we can get you in the same day. We can squeeze you in and get you with an appropriate diagnosis. If the diagnosis is made incorrectly, oftentimes we'll just prescribe an antibiotic without the use of the slit lamp. And if we're a viral infection, like the majority of pink eye, an antibiotic won't do us any good and can actually increase resistance to antibiotics, which we certainly do not want to do. The typical course for a viral infection or a viral conjunctivitis is about 10 to 14 days. It's a cold-like symptom in the eye, and it is infectious. It can spread. So we always counsel patients on some supportive treatment, what we can do to make the eye feel better, minimize the symptoms, and of course, minimize the spread of infection. The other piece, if it is truly bacterial, we'll prescribe an antibiotic. And if it's allergic in its diagnosis, there are some great over-the-counter allergy medications and some nice prescription allergy medications as well. So general rule of thumb, as I mentioned, anything wrong with the eye, call up your eye doctor. We have 24/7 urgent care hours here at North Shore Eye, and we'll help to make sure that diagnosis is accurate for you. We'll get you back to work or your kid back to school as quick as possible, and then help minimize the spread if it truly is a viral infection. As always, if you have any questions or concerns, feel free to call. Hopefully this was a good little episode for you and we offered you some good information. I look forward to continuing these monthly eye openers. Feel free to send me any topics that you'd like to talk about. I enjoy educating my patients, and this has been a fun venture for me. So take care, have a great rest of your week. Until next time.